But I'd like to start out with just opening it up if anybody would like to share a testimony. And we had a couple people that get to repeat, but go ahead and unmute yourself and, share your testimony at this point in time. Janie, do you want to start? I'll
Yes,
pick on you since I know you.
I'm here. Yes.
All right.
I have 100-year-old lady that I've been working with. She's keeping track of her age, actually. She's 8 months over 100. She said, I didn't think I'd ever live that long. Anyway, when I went to see her, she was in good health for a 100-year-old lady, actually, but her hands were kind of curved, and she was dehydrated really bad, and her complexion was not as brilliant as it should be. And her mind was good, but kind of wavered a little bit. And anyway, after using this watch for about 3 weeks, I went back several times in between. Her narcolepsy would put her to sleep occasionally on a visit. And anyway, all that quit. She stayed awake. Her complexion's beautiful.
Time's your
Straightened out.
say.
And it's just, she's happy. Her pain has gone away. And she almost doesn't know what to say because she's very excited also.
Now, can she change the watch on her own? She does okay navigating the watch?
No, she can't do that.
That's hard.
She has 24-hour self-care.
Okay.
So
somebody's there to do it for her.
They're able to do it for her all the time. And she's not completely disabled. She does use a wheelchair, but she can get up and things like that, if she has to. But so for 100 years old, she's really doing quite well, but this watch has just steamed her up. That's all I've got to say.
Well, thank you for that info. All right. Anybody else have something they'd like to share about the WAVwatch?
Yeah, Linda, I'd be happy to.
Lovely. Great, Dylan.
All right. So my story with Linda and the WAVwatch started, say about February of this year. I think maybe January. Well, first, let me start. My name is Dylan. I'm 30 years old. I was having some health issues. I was in and out of the hospital with heart issues and was having palpitations and a lot of anxiety about it. And that kind of made my anxiety a lot worse because I didn't know what was going on. Ended up going to the ER quite a few times, and all my test results would come back, oh, you're fine, is what they kept telling me. You're fine, you're fine, you're fine. And I'd be telling them, I feel these weird palpitations and my heart would skip a beat all the time. And I ended up getting in contact with Linda, and I did the biomeridian with her. And we came to the conclusion that it was actually Lyme's disease that was affecting me. And she said, well, I want you to be able to use this watch. And I was kind of like, a watch is going to get rid of Lyme disease. And she's like, I know it sounds off, but just give it a shot. And I had, like I said, I've been out of the hospital probably 9 times. The doctors couldn't tell me what was going on with me. And I used the watch for a month, and I ended up getting rid of the Lyme's disease. And since then, my heart, I haven't had palpitations. I just had a better overall quality of life. And since there's so many frequencies on that watch, I've been able to use it for plenty of stuff. I'm actually a United States Marine Corps veteran, so I have a lot of back problems and knee problems. Sometimes I have trouble sleeping. I have really problems with anxiety. And I've been able to utilize that watch and use that watch for everything. And it's actually, I was in such a bad place that I wasn't able to work. And this watch gave me the ability to be able to go back to work, which was awesome. So I'm back to making money. Life is good again. And my family and a lot of people were seeing how this watch was affecting me and actually went to go get one themselves. And my mom, she has had troubles with sleeping herself. She started using the watch for that. And now she can sleep. So that's pretty much my story. The watch works. Just give it a shot. And I think it's going to be able to do wonders for you guys too.
Thank you, Dylan. And I'm so glad that you mentioned that you've served in the armed forces. Thank you so much. It's such a simple little sentence for us to say when we don't realize everything that you put into that service. And again, thank you. So glad you're doing better. Anybody else like to add a testimony? Was there one more person that had one?
I will.
All right.
Can you
Hi,
hear me?
Lisa. Yes, now I can.
Great. So I wanted to say I have had a few clients in the last 2 weeks
Evidently, she poked in the same time I did.
contract COVID. And they all had the watch. I had them run the COVID folder for 2 of them. Within about 5 hours, they felt better. One of them was very ill with it. After a whole day, she told me she felt 50% better. I had just watched like a 6-minute video of a man talking about how our electromagnetic field is having an effect on viruses. So I called her and I asked her to run EMF detox, and she did. And after the 8 minutes, it was 100% better, and her symptoms never came back. Believe it.
If that doesn't tie it together, I don't know what does. Wow.
Yeah.
Wow.
Yeah.
Thank you for reminding
I've
us
been-
that. That just kind of
Videos
gives me
and stuff.
chills, Lisa. Wow.
Mhm.
Okay, who else was on?
Okay, here we go.
Someone else wanted to add a testimony. I'm sorry, was it Larry?
Hi, Linda. It's Maggie.
Hi, Maggie.
Hi.
There's
One of the things that
My
I should,
video stopped. Dang on phone.
one of the things that I should always let you know is that I do have a pacemaker, and of course, none of this affects the pacemaker at all. So anybody that's uncomfortable about doing this or using the watch because they have one, of course, you don't have to worry about it at all. But in probably the month and a half that I've been using this, I feel 15 years younger. And the older you get, there's more things wrong with you. So I have used so many different settings in the WAVwatch. I just can't thank you enough. And I'm talking to 4 other people that are considering getting it too.
Thank you. And I mean, I know I developed it, but isn't it so much easier than trying to figure out what pills to take?
It is. I've been able to
Video
drop
has stopped.
I've been able to drop a couple of my vitamins. I first heard you talking
Now
about
you
iron
go back.
deficiency, which I've had since I was first diagnosed about 8 years old, and have taken iron pills all my life. I no longer take iron pills. I've got a couple other vitamins that I don't have to take anymore. So really, even though in Canada, when it lands at my front door, it's a lot more expensive than you guys in the States. But it's saving me on vitamins. Eventually, it's going to pay for itself.
Perfect. Thank you. Thank you very much, Maggie. There's another gentleman that wants to add a testimony, and then we're going to start with our information. Zoom user, I think that's you. Zoom user, are you trying to give us a testimony? Okay, well, we're going to go ahead and start, sharing some information about nerves. So I'm really excited about this to just kind of update you with some ideas that I have added on the WAVwatch. Okay, so before we say too much, I just wanted to remind you that you can find recordings of this on Facebook, WAVwatch Frequency Fanatics. I also have a lot of these transferred over and different videos on Rumble. I have different videos on WAVwatch. There's a 20 page booklet, and then the newer watches have a 24-page booklet. And so those are all things that you can really do specifically. But this time I thought I'd be a little bit silly, but truthful and say if you're having trouble using your WAVwatch, maybe just connect with a younger person like your kid or your grandkid and see what they can do for you, because it's totally amazing how much they do know and how quickly they can learn something and show you something without even reading the directions. It's just in their genetics already. So try a younger person if you need a little bit of help. And then don't forget that we do have to mention disclaimer each time. And this is not a licensed medical product. It just uses acoustical frequencies. And I still have a hard time saying acoustical frequencies are experimental, even though they have been around our whole lives since the beginning of the world. They're still experimental. And that kind of refers back to what someone was saying about the pacemaker. If you have been told that you can't listen to music when you have a pacemaker inserted, then you can't use the WAVwatch. But I don't know of anything that says you cannot listen to sound. So that's all the WAVwatch is acoustical frequencies that are a little bit more like a bee buzz. And so you don't want to necessarily hear them, but you want your body to feel them. So anybody that gives us a testimony, it's volunteer, nobody's been reimbursed. And then the other idea on our WAVwatch is that we do use words that sound like a medical diagnosis, because we have to use those so that you know which frequency might apply to you. We are not diagnosing anything for you. You are doing your own self-care. So there is a new updated watch, and there is not anything different about the watch itself, except that it now has 1,000 frequencies instead of 850 to 870. So you can be in charge a little bit more of your body, mind, and spirit with all of those selections. And I say this a lot, and I put this up on the screen, and it's in depth. This is how the WAVwatch works. And I'm going to kind of let you read that and see if it makes sense. So there's a lot there, isn't it? So what I thought is I would reduce this down just a little bit. So what Dr. Lipton was saying is that wave frequencies are 100% absorbed, where chemicals that go through your body go through at a foot per second. And that's actually so slow that your body burns up that chemical. So you only have 2% absorption. And so that gives me the answer. It just kind of hit me over the head when I saw this information. Oh, that's why we need to take medicines over and over and over again, because they are so slowly absorbed. So I thought that was unique and another way to let you know how the WAVwatch could be helping your system. Now, today, what I wanted to jump into is information about nerves. And it's very important for us to know that there's now a little bit of a transition point that is changing about our nerves. So research from the Niels Bohr Institute shows that nerve impulses are actually sound pulses. So when I also found this information, it made perfect sense to me why nerves was one of the most amazing turnarounds that people had on the WAVwatch. And again, there it is, right out in front of us. Now, this is a theory that has been out since about 2005. And they say that it's going to take about 50 years for us to relearn our thinking that our nerves may not be electrical. So I had to learn a little bit about this. In my mind, I didn't know a lot. I didn't know who Niels Bohr was. And boy, was I embarrassed, because I'm not really a physicist, but look at this. This is Niels Bohr when he was a young man. he was friends with Albert Einstein. And they sparred back and forth in the day because they had interesting and different concepts, not necessarily contrasting, but just different concepts. And so, there was a little bit of give and take there. But Niels Bohr is known as the father of quantum mechanics. So he has been instrumental in so many things that they are doing today that are so futuristic, and he received a Nobel Prize for, his research on the atom and how it, all the different parts and pieces and how it fits together and that kind of thing. And I had no idea about this. I didn't remember that from my high school training, if you will. But anyway, this is somebody else that we need to be paying attention to. So what he said back in 1913 is true today. So his school of physics in Denmark, the Niels Bohr School of Physics, has actually lots of premier research scientists, and they are the ones that are saying that our nerves may function as sound pulses. So is it any wonder that when you receive a frequency in a acoustical sound pulse, that some changes could happen in your body? So when you are working with a nerve problem, my beginning information is on page 3 of the booklet. And I say it right in the booklet. And I say, start with inflammation, pain, and trauma. So that's one of the first ideas if you're having any concern about nerves. So then the second idea is this whole selection here. And I've added about 10 new ideas from the original watch that had about 850 frequencies on it. So you would go to pain icon, and then you would arrow down to nerves. And when you open up the nerve folder, there are all of these choices. So I want to tell a story, several stories maybe, to let you know that it's not going to hurt you to run more than one of these. Yes, maybe you have been diagnosed with one idea, and they tell you it's one idea, but that doesn't mean that you couldn't run more of these frequencies. So here's like story number 1. And I'm just keeping my fingers crossed here. I got a video. This was when I had the 870 watch, and I did not have Bell's palsy listed. But this young lady had had problems. She'd had 2 Bell's palsy attacks. And for 25 years, half of her face had been drooping. And we were kind of assigned to sit by her, at a banquet, didn't know her, introduced ourselves, could tell that she had problems. And my husband, Carl, immediately took off his watch and set it for her and put it on the dystonia frequency. And here's what happened during our dinner.
Okay, so you have a WAVwatch on, that's what that is.
Yep,
You've had it on for how long?
less than 10 minutes.
Less than 10 minutes. Your background is that you have what?
I've had Bell's palsy twice on the same side starting 20 years ago. And so part of that means that my shoulders have not been straight together for a while because this is always pulled up. And my right shoulder literally just dropped.
And your eye?
My eye is just not able to open and close the way it normally does. And now I'm feeling air on my eye in ways that I haven't. Less than 10 minutes.
Less than 10 minutes.
I can't wait to see what happens.
Well, that's a short version. And the longer version is telling you that in the time that it took to eat dinner, that her Bell's palsy of 25 years went away using the frequency labeled dystonia. Okay? So I hope that gives you a good idea. And then one more just verbal story. I've told this one a lot, but it is my precious story. I had a gentleman call, and he said that he had bought the WAVwatch for his wife with Parkinson's. And then you could tell he kind of got embarrassed, and he cleared his throat. And finally, he just blurted out. And he said, and we sleep really close together. So then I waited again, and he blurted out, and I could feel her frequencies when she wore the WAVwatch. So then he continued, and I woke up the next morning and my feet didn't hurt. And I'm going, oh, that's so neat. That's really neat. And he goes, no, you don't understand. They've hurt for 15 years. I've been on medication for 15 years. So he felt a frequency that was embedded in the Parkinson's frequencies, and his neuropathy went away. So they shared frequencies from one WAVwatch. Now, I can't get any better than that, can it? Isn't that terrific? So I just was amazed how that had changed him. So we'll see if I can, I'm having some trouble here. We'll see if we can go down to the next slide.
Okay, so you are.
There we go. So you can have all kinds of problems. You know, we don't know what we do every day that might give us a pinched nerve of some kind, of course. So we can have some problems with arthritis. Somebody's telling me they're having some trouble with the sound.
Yes, I am too.
Any suggestions on that? Anybody?
I can hear you fine. I'm not sure what's going on.
Okay. All
I
right.
hear you fine.
Okay. Well, I hope the majority of people are hearing that. Okay. So anyway, you know, we don't know what's going to happen in our lives. Obviously, just changes in age can cause some problems with nerves. You know, we sit at our desk all day long and type on the computer. That's going to cause some problems. Our posture, you know, wear and tear, bone spurs, the list goes on and on. But we can have a lot of things that can be connected with nerve and pinched nerves. So this is a big folder on the WAVwatch that you should be able to share with people. Now, this is just a little idea really quickly, the ulnar nerve, the median nerve, you know, and how these inflamed nerve roots can cause problems. And so that's why I was kind of saying that you want to start with inflammation, pain, and trauma. Again, we don't know what little accident or tripping we might have, that some kind of trauma that's going to cause some problems with our nerves. So that's a really good starting point. And then you can get more specific. But the next one that's on there is brachial neuropathy, and it's kind of like a peripheral neuropathy, and it damages a single set of nerves. And so I'm just kind of giving you an explanation of these. It doesn't mean that you have to be diagnosed with this in order for you to run that. I would run through all of the nerve folders if you're starting to have problems with nerves. It's very, very important to do that.
Linda,
Yes.
in my book, I have the 1,000 frequency WAVwatch. The book under nerves has Bell's palsy. Then about 4 down, it has dystonia. So is one different from the other? Because a while ago you said dystonia was used on the older watch for Bell's palsy.
Well, that's kind of the point that I was trying to make, is that some of those frequencies are interrelated. And so dystonia is a type of nerve, you know, damage, but it did help someone who had been diagnosed with Bell's palsy, you know. So that's why I'm saying that you want to play more than one idea, because there could be some frequencies inside a different one that's labeled differently that could help you with your problem, because we're all unique. You know, that's part of the problems that we are acknowledging with some of our, you know, other medical sources that we go to, is that they all specialize, and maybe they're not realizing the uniqueness of our body, and that one pill doesn't fit all, you know. So it's the same way. One frequency doesn't fit all. So play more than one of them. Yes.
Okay,
Does
and
that
also,
help?
yes, and also you said a while back something about we could set our watch up so that it plays all the different things, frequencies under a certain category. Is that right?
Yes.
And what is that called?
Well, you're just looking at picture number 3, page number 4, and it's step 3, and it shows you the pictures of 4 different ways that you can set your watch. And the 4th one, a new loop on there, will play every single one of those ideas.
Thank you.
Okay. All right. So we might wait for questions until the very end, and I'll see if I can answer them then. I'm having trouble accessing that right now for some reason. Not sure why I can't get there, but. Okay, so let's see where else we're at here. So here's carpal tunnel. So a lot of people are having trouble with carpal tunnel. And of course, the major problem, the weakness, the tingling, it can just get worse and worse and worse. And we do it setting out our computers at the wrong angle so easily, or repetitious movements at work, that kind of thing. So it can get very bad. I did not realize how bad it got until I had a lady come to my office. And she had carpal tunnel pain for 25 years. And I took an image of her with my thermography camera. And her hands, we could barely see her fingers on the top photo. And this is really common when somebody has a circulation problem. And so that's all we knew. So she wore the WAVwatch when it was a prototype. But what she for about 30 minutes, 5 minutes, 35 minutes. And what she told me was that her right hand goes numb and that pain will shoot up from her hand. And what I didn't know, and I guess it isn't in this testimony, but she said that it actually freezes on her chest. If she doesn't kind of wake up in the middle of the night and flip her hand over the side of the bed, that when she wakes up in the morning, that her hand would be frozen on her chest. And it would take maybe an hour for her to be able to get her fingers to move and to pull off of her chest. So she wore the WAVwatch for 35 minutes. I took the second picture and she was actually complaining that her fingers were ice cold. And when you touched them, they were. So the only effect that we knew was that the WAVwatch frequencies made her colder, made her fingers colder, and the circulation changed. It actually looked like it got worse. But look what happened. The next morning, my pain was gone except for a slight tingle in my fingers instead of the usual hour of numbness and tingling and shaking. It stayed gone for about 3 weeks, and she just used it one time for 35 minutes. So it had a huge effect on her. And I have heard that testimony from other people who have had nerve pain, and they'll say, yeah, that area got really cold. So I don't know if any of you have had any of those ideas, but sometimes people have different changes, or different effects. And then when they give it just a little bit of time, maybe the problem has changed drastically for them. Now, another one that I was able to add on this set is cranial nerves. And I just captured this picture from KDVMA, giving them credit here. And it basically shows us all of the cranial nerves. So, if you're having trouble with any of these ideas, this might be one that really speaks to your body. So again, play them all, but pay attention if you feel anything when something is playing, so that you could actually play it for a longer time. And so these are all of the ideas that the cranial nerve one is trying to follow. So it's a huge idea here. Yeah, I think everybody's muted, but we're still having some feedback here.
Yeah, we've got some people that might need to mute.
Falling out of windows recently.
Please mute yourself. I'm trying to mute people.
Trying to cover up. It could be.
Okay. So here we have the whole idea with the cranial nerve. So that's a new one that was on there. Okay. And then another idea that has been added, or excuse me, I guess this isn't, the next slide is on dystonia. So involuntary muscle contractions that cause changes in movements. But again, this is the one that I kicked this whole idea off with. This is the frequency that really worked with somebody for Bell's palsy. So again, you don't know which one might be the most helpful, even though you've been diagnosed with a particular idea. Our bodies are all unique, so try more than one idea. Now, this is a new one, and the GBS, the syndrome. We have heard more and more about this in the news. So I was so glad to be able to find this particular frequency. We all know that this one, I think I'm not stepping on any toes here, but if you've had anything done in your arm, those people tend to have more problem with this syndrome. And it can come on quickly and really build up for a couple of weeks. Sometimes it can diminish, sometimes it doesn't. But this is your immune system attacking your healthy nerves. So usually it's going to start with some tingling in your toes and going up all the way through your legs and your body. Your walking gets harder and harder. You might not even be able to swallow or to breathe, so all of these symptoms are related to that. Now, this is a new set that I just put on the WAVwatch. And so I don't have anybody that's, has given me a testimony that I know of, at this point in time. So if you have had or know somebody that has this, it would be a great idea to share the WAVwatch with somebody for this particular idea, because this has really affected our younger people, in the 30 to 40 age range. We are having a almost epidemic proportions of this problem. So it's, again, very serious. If this would bring any relief to somebody, it would be, very helpful to them. And I just kind of want to give a shout out to somebody. I'm not sure that I should be using names or whatever, but I've got several people that are so tied to helping others and reaching out. And I have a couple of people that have bought 20 some WAVwatches and shared them with their friends and family. And the testimonies are just coming in. So I was shared a testimony yesterday, and the person said that they had severe back pain for they said 50 years. I haven't seen it written down, so I hope I was saying that correctly. But anyway, they couldn't walk at all. They could walk out to their, mailbox, and that was about it. And they've had the WAVwatch now for about 6 weeks. And he was able to walk 10 blocks the other day with his brothers. And so that was a celebration. And he believes in the WAVwatch so much that he's reaching out and touching others. So he reached out to someone else and they have a testimony, and they reach out to somebody else and they have a testimony, So I guess that's why I'm throwing this out. This is a big one. And if you know anybody that you could share your WAVwatch with, it would be amazing to see if there's any differences. So keep in touch if you have something like that, that somebody like that or a particular problem. Now, I also added a new one is just labeled nerve compression syndrome. And so if you look this up to see what it is just a little bit, your doctor is going to call it a pinched or a trapped nerve. So this is excess pressure. It can be from a lot of different causes. It could be from obviously an accident, an injury, a health problem, from even, a tumor inside your body, putting pressure on a nerve. So this might be, some kind of a frequency set that would work on one person that has been labeled with that, but not on the next one. So again, try to work with many different ideas and go through those. Another kind of frequency that we have that's just labeled palsy. And so there are all kinds of palsy. So it is a form of, paralysis. And so this general frequency set, does it work with all of these? I cannot say. I do not know, but that would be the idea, that it might be a more generic type of frequency that could work with even a Parkinson's disease, someone diagnosed with Parkinson's that is shaking. So you do not know, again, whether they need the Bell's palsy frequency, if that's what they have, or the palsy frequency, or the dystonia one. So again, I have this theme today. It's like, play them all, there's many frequencies in here. And each one of these sets that is labeled with a particular name could have up to 30 different frequencies inside it. So if you have used your watch and you've kind of touched one for 5 seconds and then touched again to make it go forward to the next one, you'll hear it make different sounds. And each sound is unique. So there's 1,000 unique sounds on the WAVwatch. So I've even picked up one, and I can't repeat it. I don't remember which one it is now, but it makes a beat. You know, it actually has a beat to it. So you never know what the sound would be. But again, the whole idea of the WAVwatch is that you don't have to hear it. Your body is going to feel it. And again, that goes in with the idea that we can feel and our nerves are sound pulses. So that maybe that's why some good changes are happening with the WAVwatch. So this one was a new one for me, and I wasn't exactly sure if I could even explain it correctly, but I found frequencies for non-spastic and spastic paralysis. So again, the spastic is going to be more like a muscle stiffness, involuntary spasms, muscle weakness, and there can be lots of causes, cerebral palsy, the ALS, stroke, spinal cord energy, and paraplegia, so lots of ideas could cause the spastic. So very stiff, jerkiness, tight and jerky, as you'll see on the right side. But there's also non-spastic cerebral palsy, and this is muscle tone that tends to fluctuate. It's a little bit fluid and loose and just doesn't quite fit the same category as the spastic. But I didn't find a lot of information about any disease except for the cerebral palsy that could be related to the non-spastic. So those again are on your WAVwatch, and they could be used hopefully for many different ideas, not just the idea that is on here. It might help somebody who has, a problem with, again, Bell's palsy or whatever. So again, play those ideas. Now, one other idea that I've mentioned before, and then people get confused a little bit, but you can muscle test. If people are into muscle testing, they know what I'm talking about. I have 2 hours of muscle testing information on my WAVwatch Frequency Fanatics on the Facebook. You can go there and you can learn about muscle testing, or you can just click muscle testing on, the internet, Google it or whatever, and learn about muscle testing. And some people, in fact, probably 99% of the people that I work with can learn muscle testing very easily, and they might be able to actually feel which frequency would be correct for them to use or be very, very helpful. So that's actually a really neat idea too, if you have a limited amount of time, because if you are going through all of the frequencies for nerves, that might be something to play all night long. But if you're in pain or you're jerking around, you might, if you can muscle test, you might be able to just pick out and say, oh, my body needs the one for neuropathy, or my body needs the one for the non-spastic, or it needs the one for spastic, versus plain dystonia. And many, many people are able to muscle test. So that might raise some questions we'll ask at the end. So I have showed this one before, but I think it's worth showing again. The person that I mentioned who purchased the WAVwatch for his wife with Parkinson's, when I asked how she did, because he had an amazing turnaround just overnight with his legs, his feet, he said, no, the Parkinson's one didn't really work with her that much. And so I said, hey, we'll try the one for tremors. So when he tried the tremor one for her, that's when her Parkinson's tremors really abated. So again, there's another idea of why we need to be able to move back and forth on the watch and try some different frequencies until we find the one that works for us. So here is just a quick video. It's a little bit sideways. Couldn't get that right for some reason. But this person says, I have not been able to hold a cup of coffee for 25 years without spilling it. After 1 hour of wearing the WAVwatch wearing frequencies for tremors, my hands were 90% improved. So here's the video he sent me. So he had been like that for 25 years. So here's his next video. It lasted for about a week. Then after using my weed eater, my weaker hand shook more. I just played the frequencies again. How easy is that? I'm going to save a lot of money on coffee. He had a good sense of humor, didn't he? So here's the second one. He's going to save a lot of money on coffee. It's not perfect, but he had a short time to use it. So he was here when I was developing the prototype. So now that we have more frequencies, somebody who has had a problem, add more frequencies in. That's what I keep saying. I'm like a broken record today. Add more frequencies. So I think we're just about to wind up on this, but just to finish a few ideas, there's also frequencies for polyneuropathy, and it involves damage to the nerves, which are outside the brain and the spinal cord. And this can damage a lot of nerves. So there is a frequency for that. I do not know that I have any testimonies on that, but we would hope that somebody is going to be helped by it soon. Now, I was able to find the polyneuropathy. If you actually work with a medical doctor, they're going to suggest a lot of Tylenol. And if you notice in the news lately, there's a lot of bad information about Tylenol and acetaminophen and lawsuits. All of these have been caused, have some problems now. So people aren't wanting to take these over-the-counter medications necessarily. And they're wanting to find something that's a little bit more natural. So maybe the WAVwatch would help people. So, we also have COX-2 inhibitors. They have opioids, they have tramadol, the list goes on, and they're acting, on the pain pathways. And then they also give them antidepressants, anti-seizure medications, and anti-epileptics. So wouldn't it be nice if you could share this idea with someone else who has a problem, who is really wanting to get off some of their medications? I can't make any promises. Obviously, I'm not a medical doctor. This isn't, it isn't a medical device. I'm just saying that we do have so much information out there that we are not really accessing. And another big question that I get, people will say, well, what's the proof that frequencies work? But what I don't hear is, oh yeah, when I started taking XYZ medication, I looked up the proof that it worked. That's what we are not doing. We are just assuming that because there is a medication for it, that it does work. But when we look up, when we actually take the same time to scrutinize a medication as we would scrutinize the WAVwatch or frequency tools, we're not doing equal scrutinization, if I can say that correctly. So we need to do that both ways, and look for the scientific studies on both ideas, because so often what we're missing is all of the damage that some of those treatments can cause with our medications. So again, I'm all about making life a little bit easier with less pain medication if we can, if it works for you. So we've had a few testimonies on sciatic nerve. So this isn't, information I got from Cleveland Clinic. And it's going to originate in the lower back and down the leg. And again, you'll see that word irritation, inflammation. So again, that's why if you start with inflammation, pain, and trauma, a lot of times different nerve injuries have really improved very quickly. And then if you can, go deeper and play the sciatic one, there might be some more improvement there, or you might have to play a couple of other frequencies. But we have had improvement in this idea several times. Then the trigeminal nerve is actually on the basically part of the cranial nerve disease imaging. And so this is one that's very specific. So a lot of people are diagnosed with that, and that might be something that could give some more support for that idea. Then definitely the cranial nerve disease idea would be very helpful also. So this is what this is all about. And lots of people are suffering from this. They've got a lot of, touch and heat on the side of their face, and causes lots of problems, headaches, the list goes on and on. So anyway, just covering an idea, just showing you, I'm not a medical doctor, you're not medical doctors normally, we've got a few medical doctors that come on, and I really appreciate that. So all kinds of ideas for radial nerve injury. So it just gives you some information there. So we're going to have lots of tingling and numbness, muscle weakness. You can't extend your fingers out. So we've got a frequency for that. Okay, and then the vagus nerve is one of the biggest ones that we need to actually be working with. And that is one of my favorite ones. I'll play it sometimes all night long because you'll see the amount of nerves that the vagus nerve is connected with. And it's a huge one. It can be damaged. I've done a whole 1 hour concept on the vagus nerve, and they, of course, have surgeries now for the vagus nerve. And, there's some pros and cons on those, but you might start with a WAVwatch or share the WAVwatch with somebody who has vagus nerve damage and see if there can be any changes made on that very, very easily. I guess I have one more. Oh, I have two more ideas maybe. Nerve damage can be caused by surgery, by diabetes, alcohol problems, over-the-counter drugs, viral infections, heavy metals, Botox injections. So a lot of people, I'm started to say women, but maybe not necessarily, Botox injections can be very damaging to the vagus nerve. So be very, very careful if you're looking at any of those ideas. Different prescriptions. And of course, nerve damage if, by an accident. So the nervous system, the vagus nerve, can get damaged fairly easily through lots of different ideas. So the vagus nerve is so important. Like I said, I did a whole 1 hour on it, but these are just quickly some of the ideas connected with vagus nerve problems. So all kinds of emotions, anxiety, depression, migraines, our GI tract can be messed up, inflammatory bowel disease. We can have poor circulation, adrenal problems, insomnia, OCD, ADHD, PTSD, the list goes on. And I'm just reading it. You can read as good as I can and faster than I can, I know. But that is how important your vagus nerve is. So sometime if you don't know what to play, pick out the vagus nerve and just circle it all night long. That's a good one. And it's helping a lot of different ideas. So the very last one that I put on here that I was able to add was whiplash injury. And I don't think I have anything on that specifically, but I just kind of wanted to wrap this idea up with letting you know that the vagus nerve is actually definitely connected to so many ideas, and all the nerves all together can be very, very helpful. So I was able to add a lot. So I'm going to stop sharing and see where we're at on, I got lots of questions, and I don't know if anybody, if my son was able to answer some of these questions while I was talking or not, but I put you on the spot there, JR.
You're fine. I
All
think,
right.
I think we've answered all the questions. There's a recent one that I don't know the answer to, which is, do you make the slides available? I know we do have a replay on Facebook. That's probably the best answer.
Yes, that's the best answer. Mhm. Yep. And a lot of the slides have been turned into presentations that are put onto that are put onto Rumble and YouTube. And they're maybe added to a little bit and with some different narration from somebody that I paid to do that. So that's Ina. She does an excellent job. So anyway, I hope some of these questions got answered, and I hope you're as enthused about using the WAVwatch for nerves as I am. Again, I've had so many turnarounds with that. Some of you may not have seen the testimony that was brought forward with a stroke victim, obviously, and the changes that happened to her in a very, very short time. And so again, we're talking about brain and nerves and that kind of thing. And the turnarounds have just totally blown me away. Didn't even suspect some of those ideas. So I guess I can kind of open it up. It was a little bit hard when we were doing it before, but can anybody raise their hand if they want to make any comments or ask any questions? And other than that, we're kind of winding down. Just ideas about nerves today.
Linda,
Yes.
Janie again, and the nerves have been one of my favorite things to use from the very beginning. And I've had this watch for 2.5 years. And I have found that if nothing else kills pain, and you've tried all the others like you would like for it to, the best thing to do is to go to the nerve folder. And the ones I like are like from the peripheral nerves on down. And I have also found out that about any pain that you have from side to side on your body and your back or wherever, sciatica will probably take care of that one for you. It doesn't have to go down your legs or anywhere else. It's just kind of a horizontal pain. And for me, it gets rid of it. And polyneuropathy is absolutely wonderful. That's the first pain one that I usually go to is polyneuropathy because it's always worked very well for me. So, but that's what I've learned, that nerves will probably solve if you can't find something else that works. It may be the problem answer right there. So
Perfect. Thanks for that idea. I love it. Right. Anybody else?
Linda, hi, Ruth Donovan. I don't think I received the link for attending this meeting. Did you send them out as usual?
Yes, but there is an update. I have been doing this for a whole year and I had a code for the whole year. And then we extended that code for 2 more years, I think maybe. And so it should have been the same link. And there is a code attached now so that I don't have to click everybody in. And that code is WAVwatch. So you may have to type a code WAVwatch in, but it looks like most people got in today. So we've got, several on board with us today.
Okay.
So you're not getting an email, Ruth?
Yeah, well, I didn't see it. I couldn't find it.
Okay.
I was looking. But I've gotten them in the past.
Okay, so I'm not quite sure. Sorry about that.
Okay, and I have one other question. If I have a friend who has located a specific pathogen in one of her clients' body parts in the blood, is there a way we can ask you if there's a frequency for a specific pathogen included in anything?
Well, I'm not exactly sure what you're saying. You want to talk to me afterwards?
Yes, that'd be great.
Okay, yeah, that would work.
Thank you.
Uh-huh.
Can you hear me now, Linda?
Oh, I can. All right.
I'm sorry. Somehow I got kicked off something that had to come all the way back through. But I had the testimony with Lyme's disease, like the retired Marine guy. I'm a retired 30 years Air Force. And I was bit by a tick about 6 years ago. And the doctors at the Air Force Base told me it was a tick-borne virus, and I had Lyme's disease and some West Nile. And they said on a scale 1 to 10, I was probably a 2. They wanted to put me in the hospital and said that's where I would stay. And it says, give me whatever and I'm going home. And then I went to some people who did homeopathic stuff, and they got all the swelling down in my legs and arms and everything. It came up like in a couple days. It was real quick. I thought it was a fire ant bite. But anyways, I still suffered in a lot of stuff for about 6 years till this WAVwatch came out, which I saw on Truth Seekers 88. And I'll tell you what, it started making a big difference. I still have some muscle pains and I'm still looking for it, but I feel probably 95% better than I did 6 months ago. So I really appreciate, this is really great. So.
Well, I'm really glad that you got through to give us that amazing testimony.
Yeah, I'm not computer savvy, so I had a lot of problems trying to get back in, but I figured it out. My anxiety went way up trying to find out. But you do that when you're in your 70s, so.
I know. I'm there too.
So.
And just in case you haven't seen it, I do have 2 hours of information about Lyme disease in Facebook. So there's 2 different series there because, I could talk for obviously hours about Lyme disease, and what they're not telling us is how contagious it is. That's what they're hiding. They keep saying it has to be from a tick bite. That is not true. Mosquitoes are passing it. You can get on an airplane where the air is circulated, obviously recirculated, and somebody might have Lyme disease on there, maybe not even know it, and pass it to you. You get off the airplane, and if your immune system is not working, you can pick up Lyme disease. Whole families get Lyme disease. So please, people, once in a while, just click on the Lyme disease icon and play it for protection, because this person can tell us how bad Lyme disease is.
I did not know it was contagious. I really didn't know that. But, when I was seeing the doctor after I went back after about a month, he was amazed how the swelling and everything went down just through homeopathic stuff. And the thing was, they couldn't understand, and they was going to do a study is how I had West Nile along with it. I said, well, it's a bug bite, it could happen anyway. So positive attitude got me through the whole thing, though.
I'm really glad that you gave us that testimony. So anybody else have a few ideas?
Linda?
Somebody was asking, is it contagious by airborne or fluid exchange? Both. Okay. So people who live in the same household can get Lyme's disease. They may be drinking after each other, they're sharing a bathroom, and they can pick up Lyme's disease. But what most people are missing is that there's over 300 different diseases associated with Lyme's disease. And so each person in the house may get a different disease, quote unquote, which is actually, the root cause is actually Lyme disease. So there is a problem there. So right now it's 11 o'clock at my hometown, and we're having the EBS go off, which is supposed to the first Wednesday of the month. So this will be fun because lots of people have been talking about this. All right, Lynn, you had a comment.
Yes, the comment is not about nerves, because I love the nerve folder. I use it all the time. But the fact that the words and the labels don't always match what the symptoms are. And so we need to be thinking outside the box every day. And the quick little testimony is, a couple of nights ago, I made some popcorn. And I like to put nutritional yeast on it. And sure enough, a few bites into it, I inhaled some nutritional yeast. And I coughed and I hacked and I choked. And I thought, what can I use on the WAVwatch to counteract this after coughing and hacking and choking? So I tried bronchitis, and that helped a little bit. And then I thought, well, how about pneumonia? How deep in your lungs did this thing go? Because I was still hacking. And so I ran that for a little while. And then I thought, oh, asthma. Now I've never had asthma, but it'll clear your lungs. So I ran asthma, and the entire thing cleared out. And I was breathing clear as could be after choking and choking and choking. So, you need to think, what do the symptoms look like? Because like to like. So not necessarily the words, you just have to put a label on it. So thank you, Linda, for this wonderful tool.
Perfect example of how you might have to try several things and keep thinking. Dorothy's got her hand up.
Hi, Linda.
Hello.
Can you hear me?
Yes.
Okay. I enjoyed your information as usual. I can't always join on Wednesdays, but I'm going to definitely add Vegas Nerve to my playlist. I have a little bit of a testimony. I had lower backache for like 2 weeks, and I tried the inflammation, pain and trauma, muscle backache, did all that. Then last got really bad gas, and I was like, oh, that's weird. But it wasn't until I was passing some blood in my urine a few days ago that I'm like, I had a kidney stone 10 years ago. So I went back and looked at your video about the kidney and saw gas is part of it, which I never knew on that. So I have to admit also, along with you and your friend, that, yep, you get bad gas. So I went ahead and ran the all the bladder and kidney settings, and I did the infection and sepsis ones. I also take colloidal silver. I do make my own colloidal silver, so I've been taking that. And that's been 3 days, and I'm doing very well now. Thank you very much.
Perfect. See, she did a little bit of research and tried something else.
Yeah. And
All right.
everyone keeps asking me, well, did you go to the doctor? Do you go to the doctor? I'm like, why? All they do is push fluids, give you antibiotics, and give you pain meds. And I've got the antibiotic part covered with the colloidal silver and your settings and the pain. And I'm drinking lots of apple cider vinegar water. So
Perfect.
as long as I can, I'll stay away from Mr. Doctor.
And not to mention, I've had 2 people tell me that they were in the hospital for kidney stones for 3 days, and it was just water and pain meds and a
Right.
$40,000 bill. So
Right.
sorry about that, but anyway.
I'm gonna pass on that.
All right. All right,
Thank you.
Deanna, if I'm saying that right, you have your hand up.
Yes, hi, yeah, you said that right. Thank you so much, Linda. I just recently bought one of your watches, and I'm also, I've been in the Air Force, retired 30 years as well. And I think I've just had a whole host of health challenges, from Lyme to neurological stuff. But my question is, if I've had COVID, haven't taken the shots, but there's technology that's in these shots. Have you seen, because I've heard like with other frequencies like PEMF, that sometimes they can actually activate the technologies, through shedding if you haven't taken the shots. But I'm wondering, have you seen anything happen similar to the watch, or do you think the acoustic frequencies are safe from that?
I think they're safe because, our voices cannot activate things as far as I know. They can. We do have, the mortal oscillation rate. You can sing a note and break a glass, but as far as I know, I feel very comfortable. And we had a testimony earlier about somebody who, I'm not quoting it very good, but she played the EMF frequencies, and that took care of the problem. So rather than exasperating it, it should be helpful for it. Okay, is what I'm thinking. Okay.
Thank you.
All right. Yeah. Somebody in the side box has said, is there a frequency for essential tremor? That is just tremor. So it would be in the nerves under just tremor. And that has worked for several people for essential tremors. Okay.
Hey, Linda.
Yes. Shafia.
Yeah. I somehow I wasn't tracking that the vagus nerve was one of the programs. And as I'm listening to you today, vagus nerve is very huge in resetting the autonomic nervous system, and especially for people who have had PTSD, mold exposure, where the nervous system is now more in sympathetic mode and fight or flight. And if one can, and there are all these other tools that I think you've mentioned previously that people can use to reset the vagus nerve. And I just didn't know if you have had any testimonials about people who feel that their parasympathetic nervous system that's calming and helps tap down the symptoms of trauma and PTSD. Have you had any testimonials in that regard?
I don't know that I can isolate it and say because they played the vagus nerve, but I tell so many people to play, the immune system, and then the feedback is that, oh, I calmed down, oh, I just, feel 100% more relaxed and that kind of thing. So that's the closest I could get to that. And, Dr. Lau, I just appreciate your information so much. The vagus nerve, I put it in the immune system and I put it in the nerve area for people to find it, because it is so important. And just what you said, it connects with everything and we are not even realizing how important that is.
The
And,
vagus nerve is just in the new watch, but not in the old one.
no, it's in the old one.
Okay.
Yep, definitely.
Thank you.
Yep. All right, Dorothy? Dorothy's hand is up too. Maybe we missed Dorothy.
You already got to me.
Oh, already got to you. Okay.
I just
Wait,
figured out
lots-
how to put my hand down. Thanks.
Lots of names here and I'm getting confused easily.
Same here.
So anything else that anybody wants to add? Again, nerves can be one of the most important folders, but there's so many important ones, Lyme disease, the inflammation, pain, and trauma. Don't forget parasites are unbelievable, so that's why I say to play them as a protection, once or twice a month at least, it just depends on how much you're using your watch, and once in a while we'll see people that post and say that they're not getting any benefit from the WAVwatch. So I hope that they're trying some different ideas and that you can pass that around and share with people. So unless there's anything else, we'll probably call it a day. And just want to say thanks for coming. Appreciate you. Bye-bye.
Thanks, Linda.
Bye-bye.
Thanks.
Thanks, Linda.
Bye-bye.
Thank you.
Bye, Joy.
Hi, everyone.
I'm going to email you.
All right.